Hi, my name is Elena, and today I'm going to be talking about mechanical ventilation, weaning, and transition to BiPAP after a weaning. Okay, so for our learning objectives, today we will be learning about introduction to my patient history, explain my role, successful weaning, and what a BiPAP looks like, management phase, ABG for a COPD patient, ventilator information, precautions for weaning process, patient hemodynamics. Uh, Patient is on SIMV, um, types of SBTs, preparation for successful SBT, indication for a successful or a failure SBT, weaning parameters prior to extubation. And then we will be discussing post extubation, hemodynamics, initiation of BiPAP, BiPAP settings and alarms. Patient continues to deteriorate. What do ABGs look like? Types of failure, factors for rapid response, role of a rapid response team, and then my works cited. So for patient information, we have a 55-year-old patient, Mr. Smith. He has emphysema. He is approximately 110 pounds, which is equivalent to 50 kilograms. He has lived with COPD diagnosis for almost 10 years now. He is currently on mechanical ventilation. And then today, our attending physician wants to be very careful with the weaning process, and of Mr. Smith, as he has a history of difficult extubations and maintaining spontaneous breathing after being extubated from a ventilator. My role as an RT is to monitor and manage Mr. Smith's care alongside our physician. Our number one goal is to be able to extubate Mr. Smith successfully, but above all, is making sure that Mr. Smith is able to breathe by himself and keep his airway patent. Okay, what is BiPAP? So, BiPAP is a form of a non invasive ventilator or assist ventilation system to help patients um, to kind of have that extra pressure in their lungs to be able to maintain their airway without being put on a ventilator. Um, so BiPAP can be used prior to intubation, normally on COPD patients. Um, and our hopes with the BiPAP is to kind of keep them away from a ventilator. During post extubation, though, BiPAP can be a form of positive airway support and pressure for our COPD patients to once again keep those lungs open and extended a little bit, just to kind of help give them that extra support that their body was used to during intubation to keep them from getting re-intubated. So BiPAP has two levels, like I said, of pressure support. One of them is higher during inhalation, which is known as IPAP. And then during exhalation, it is a little bit lower pressure, so it's known as EPAP. BiPAP is delivered via mask. It could be either a nasal mask, which just covers your nose, or a full face mask, which is what covers your nose and your mouth. Um, Key benefits is to provide non-invasive ventilatory support without patient being intubated. It increases oxygen levels and keeps airways open to improve ventilation. Indication for use, like I said, once it's used for patients with COPD, CHF, asthma, pneumonia, and sleep apnea. Side effects are most common with BiPAP is that their airways get really, especially like their nose and their mouth, get really, really dry, just because it is a cool, dry air that keeps being pushed into their lungs and their airways. Skin irritations and pressure sores due to the mask, and then stomach bloating and headaches.